A pediatric SOAP note is a structured method used by healthcare providers to document a child's medical condition, treatment, and progress. It follows the SOAP format subjective-objective assessment and plan ensuring clear, concise, and systematic communication in pediatric care. Using eAuditor, medical teams can digitize assessments, identify documentation gaps, track errors, and ensure standardization in pediatric SOAP notes, ultimately improving care and communication among healthcare providers. Define assessment scope. Evaluate SOAP notes for clarity, completeness, and accuracy. Ensure compliance with pediatric documentation guidelines, HIPAA, AAP standards. Identify missing or inconsistent information in patient records. Select eAuditor checklist review. If each SOAP component is properly documented. Assess legibility, relevance, and medical accuracy. Verify adherence to facility protocols and pediatric-specific needs. Gather relevant data access. Pediatric medical records and previous SOAP notes. Review facility documentation policies. Subjective S. Assessment, verify documentation of patient history, symptoms, and complaints from parents or children. Ensure notes include chief complaint, symptom onset, feeding, sleeping patterns, developmental milestones. Check for missing details that could affect diagnosis and treatment. Objective O. Assessment. Confirm documentation of vital signs, temperature, heart rate, respiration rate. Ensure growth charts, weight, physical exam findings, and lab results are included. Assess whether observations, skin color, hydration status, respiratory sounds are detailed. Assessment A. Evaluation review. If assessment logically follows subjective and objective findings, check for clear diagnosis or differential diagnosis. Ensure age-appropriate conditions are considered. Developmental delays. Common pediatric illnesses, vaccination status. Plan P. Evaluation, verify documentation of prescribed medications, dosage, and administration instructions. Ensure care instructions, hydration, nutrition advice, and follow-up plans are clear. Assess whether necessary referrals to specialists are documented when needed. Automated reports generate SOAP note assessment reports instantly through eAuditor, including photos, if applicable, compliance ratings, and evaluator comments. Documentation gaps highlight missing subjective data. Incomplete assessments or unclear treatment plans to identify areas for improvement. Training recommendations. Recommend specific training sessions for staff on improving pediatric SOAP documentation based on identified issues. Assign corrective actions. Notify healthcare staff about inconsistencies and implement mandatory refresher training on SOAP note accuracy. Schedule follow-up. Assessments. Conduct regular pediatric SOAP note audits to maintain compliance and update documentation protocols based on recurring issues. Enhance staff training. Provide education on effective pediatric SOAP note documentation and reinforce legal and ethical requirements in pediatric records. Pediatric SOAP Note Assessment continuous improvement. Perform monthly or quarterly assessments to track improvements. Revise SOAP note templates to meet evolving pediatric care needs. Promote clear, precise, and child-centered documentation. Use eAuditor to track recurring issues and address them proactively. Summary benefits of pediatric SOAP note assessment. Using eAuditor ensures structured, accurate, and regulatory compliant pediatric patient documentation. By digitizing assessments, tracking errors, and standardizing SOAP notes, healthcare providers can enhance communication, improve patient care, and ensure compliance with medical documentation standards.